Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. Welcome you all to the first class of the Sindur Selection Series. The name of the series is completely dedicated to our brave soldiers who are fighting for us at the border. And this series is a symbol of our victory. It is a symbol of destroying the negativism. So, by dedicating this entire series to our brave soldiers of the Indian Army, so we'll start today's class. Good evening, one and all. Good evening, beta. Good evening. Welcome you all once again to the Master Nursing classes. Here, you people will learn a new thing, a important thing, a rank deciding questions concept with complete clarity. All people know that what is our strike rate in the Norcet 8 exams, including the mains and prelims. So the last few days classes strike in such extent means our entire course of classes here. Since from the beginning to till your exams, remember your entire important questions will be covered. So don't neglect any single day classes, whether it may be a theory based classes, whether it may be a concept based classes, whether it may be a clinical based classes. Don't neglect a single particular thing because we are getting the question in front of you people with our experience and with our belief that will strike in our exams, right? So yes, a very good evening, everyone. So we'll start the today's class. If everyone is ready with your things, right? So sit with a pen and notebook, and whatever the important points, important tables, important differentiations I'm teaching in the today's class, please make a note of that one. And I will give you a small assignment that one you have to do at the end of the class, right? So with a beautiful motivational quote, we will start today's very important class. That is the trust your ability to bounce back. Bacho, whatever it may be your result in the Norcet 8, forget about it. You have done your best, you have given your best, still there may be a negativism. Still there may be a negative outcome. So how to come out of that? There is only one way, that is believe in yourself. Yes, you can do that. There are many aspirants who have given the 3 attempts, 4 attempts, 2 attempts, 5 attempts, and they got selected finally. I will come up with those bounce back story also in front of you people by taking an interview of the selected candidates after their struggles. Everything is possible when you believe in yourselves. Yes, as a teachers, we can boost you people, we can guide you people, but the real struggle, the real war you people have to do. That is the true fact. If you ask 1,000 selected candidates, they will tell, yes, whatever the coaching make taught us. If we don't have the personal efforts, means so will not win the war. Right? The personal efforts take a very important and key role. So here a personal efforts with the discipline and quality content makes you a champion. Don't have to worry about the quality content. Just try to put on your efforts. Right? So we'll start today's very important class here with this beautiful question. The question is very simple here. What it is asking means administering a lethal dose of the medication to end someone's life who is suffering from a cureless and painful disease is an example of option A passive euthanasia, option B is the active euthanasia, option C is the assisted suicide, option D is the natural death. What it means? What is your answer? Do fatafat comment in the comment box. I'm waiting for your responses. Yes, this question already you people got in your test series. Okay, so many of you have chosen the wrong answer though. So I have brought this question in front of you people to clear the concept. Okay, if the questions is coming in future in front of you people, so you can solve it very easily, right? So there are two type of the euthanasia. Before going to the types of the euthanasia, I will clarify few people what is actually a euthanasia. Euthanasia is a legal procedure to terminate the life of the individual who is suffering from the cureless diseases or the very dangerous painful diseases. What it means, sir? Consider a patient A is having a dangerous metastasis of the cancer to his entire body, and he is expected to extend his life only for a month or 2 months or the 3 months. And at that particular very important time, he is getting a such a extent of the dangerous type of the pain where the patient can't bear the pain. Yes, the patient know, the relatives know, the doctor know that the patient is unable to survive after the 3 months. Means, in order to reduce the sufferings, we will terminate the life of the patient by taking the consent of the relatives, by taking the consent of the patient. That is what we call as the euthanasia, right? The word, I hope it is clear, and the concept it is clear. There are two types of the euthanasia. Very importantly, you people will get land into a confusion. So that is the active euthanasia and the passive euthanasia. What it actually means, sir? Listen, the word active means we are involved and we are giving some medication and we are doing some procedures to terminate the life of the patient. So that is what you call the active euthanasia. Consider he is the patient. Okay, so for this patient we are doing something, for example, we are giving a lethal means a dangerous dose of the medication to terminate the end of life of this patient. So that is what we call as the actively involvement of the healthcare provider to terminate the life of the patient. So that is what we call the active euthanasia is the correct answer. And what it means by the passive euthanasia, sir? Consider this is the patient who requires the ventilator support to survive his life, but here we are not doing or not involved. Okay, so it means we are not giving the ventilator support. Here we are giving a lethal dose and we are terminating, and we have to give actually, but we are not giving the ventilator support. Means we are not actively involved to terminate the life. Okay, just we are removing the support and the patient life is terminating. So that is what we call the passive euthanasia. So the answer, many of you have chosen the passive euthanasia in the test series, so I have brought this question here. Okay, that is the active euthanasia is the correct answer for this one, right? So hope the concept and question is very much clear to you people. So here the types of the euthanasia, you people have to understand the active euthanasia and the passive euthanasia. In the active euthanasia, doctors gives a lethal dose of the induction, and in the passive euthanasia, we are just turning off the support. Okay, that may be a turning off of the ventilator, that may be a turning off of the oxygen, whatever it may be. Okay, and not giving the life extending medications. Just we are withholding and we are stopping. That is the passive euthanasia, right? So hope that thing is completely clear to you people. And so here we are having the based on the consent. Okay, we are having the three type of the euthanasia where you people will confuse between the non-voluntary euthanasia and the involuntary euthanasia. So I want to clarify you people a difference between the non-voluntary and involuntary euthanasia. Okay, if the term voluntary euthanasia is coming means everyone you will choose a correct answer. Okay, if these two questions is coming in the exams means again you people will land into a confusion. Okay, so that is very dangerous for the negative marks. Okay, so let us start with the controlling the negative marks, right? So the a first very important type of the euthanasia is the voluntary euthanasia. Here in the voluntary euthanasia, the patient will give the consent to terminate his life. Okay, done with the consent of the patient. So that is what you call as the voluntary euthanasia. In the non-voluntary euthanasia, patient is unable, patient is in a coma or in a unresponsive situation or the unresponsive condition, where the patient is unable to give the consent, so done with the patient without patient consent, okay, because the patient is unable to decide, so that is the a non-voluntary euthanasia. These both are legal, okay, but this involuntary euthanasia is the illegal, okay. So that involuntary euthanasia is done against the patient will and without asking even if the patient is capable. We will not ask the patient, we will terminate the life of the patient, means that is the involuntary euthanasia. This is the illegal one, okay. So these are the a very important term, and the differentiation between the non-voluntary and involuntary euthanasia is the very important, okay. So consider it for our next Norcet 9 exams, right? So here is the next very important question from the psychiatry subject. So please do read the question carefully, completely, and give your best shot in the comment box, right? Yes, the question is very simple. A patient remains silent, resist the instructions. The patient is remaining silent like this, and patient is resisting the instructions. Means he is opposing all the instructions. Like a mother telling to a child to keep the all the toys back into the box after the completion of the play. Okay, the child is playing in the home, and the child used all the toys. Now mother is telling to the child to replace those toys back into the box, okay. But when the mother says like this, the baby will say, no, I will not replace. Means the irrationally baby will resist, or the person will resist all the instructions, okay. So this is the situation, and that's the opposite of the what is asked, okay. So we are asking the person or the patient to raise the hand, means the patient will down his hand, okay. So what we are giving the instruction, the patient is doing opposite of that one, means so this is also here the situation. The patient remains silent, resist the instruction, and does opposite of the what is asked. So which symptom is the behavior most consistent with like this here, okay. So option A is the echolalia. What is echolalia, beta? Can anyone comment in the comment box what is echolalia? Yes, a parrot like repetition of the words said by the others is called as the echolalia. Okay, so the person or the psychiatric patients will repeat the words like a parrot. Okay, so which is said by the others. If you ask the patient, did you had your food? The patient will ask the same back, did you had your food? So like this. So that is the echolalia. Okay. So then that comes to the negativism. Negativism is the question which came in your Norcet 8 exams in the mains also, where by giving the situation of the mother and baby, just I have given in examples to you people. Okay. So that is the negativism. Negativism means resisting the all instructions and doing the opposite of the what we will instruct to the patient. So that is what we call as the negativism. Okay. So when the baby is asked to put back the toys into the box, the baby will say, I will not put back the toys. Okay, so that is what we call as in the negativism. The most important questions for your again upcoming Norcet 9 exam, and for your KGMU exam and your GMCH exam. Okay, so very important question concept consider. Okay, so the answer goes to the negativism is the correct answer, and many of you have added the correct answer in the comment box. So well done, better. Okay, so then comes to the next word that is called as the akathisia. What it actually means. So akathisia is a type of the extra pyramidal symptoms when a patient takes a typical antipsychotics, typical antipsychotics, or we can say the first generational antipsychotics, where the haloperidol and other drugs will come. Okay, so when the patient is on the chronic typical antipsychotics or the first generation antipsychotics, there is a symptoms where the person unable to sit in a particular one place, and his intention he is like irrationally moves from one place to another place continuously. Okay, so that is the akathisia. It is an example of the, it's a part of the extrapyramidal symptom. Okay, the most important. Then comes to the anhedonia. Okay, so what is the meaning of the anhedonia? This is the assignment to you people, and at the end of the class, you people have to mention the complete definition of the anhedonia with examples. Okay, so at least a complete definition of the anhedonia, because it is on the very important. If you don't know what is the meaning of anhedonia, I will comment. Okay, so in the comment box at the end of the class, okay, do watch that one. Before watching my comments, please add your comments in the comment box. Okay, so that is shows your active involvement in the class, right? So here's a beautiful plan for you people for your upcoming Norcet 9 exams in the name of the Norcet 9 Navagraha test series. Okay, so this test series is a live test series from the morning, daily morning 6 a.m. to the 11 p.m. You people can attempt this particular test series with your convenient time. Okay, so whenever you want between the 6 a.m. to the 11 p.m., you people can attend the exams. Okay, so once you start, you have to completely complete the exam and then submit the exam. Okay, so whenever you want to start, if you want to start exactly at morning 6 a.m., you can start and complete by 7:30, right? So like this. Okay, so at the end of the day, means at night 11:30 p.m., you people will get the all India rank in our WhatsApp channel and in our Telegram groups, right? So then extra practice test papers also be added in the Norcet 9 Navagraha test series. Okay, here the prelims pattern, mains pattern test series we will give to you people for the extra practice. Okay, so it's not included in the daily live exam. Okay, so daily live exam papers will comes like regular papers, and the extra practice papers will be remaining continuously for your practice. Okay, so this daily live paper also will be available till your Norcet 9 exams. Okay, so don't have to worry about that one. Then weekly booster class will be provided by the masters. Okay, so here we will give all the fixed questions which will comes in the exams. Okay, by clarifying your entire doubts in the particular concept. Okay, so I will start with a very basic concept that is repeatedly coming in the exams. Then I will go to the that a hide, then a very depth concept where you people can easily choose the answer that is as a correct answer. So I will go to that point also in the weekly booster classes. Okay, so then comes to the chat box support continuously. If you have any doubts after completion of your live exam, if you have any doubts in the question, you are having the 24 into 7 chat box support. You can mention your doubt in the chat box, so you will get the immediate answer solution for that one. Okay, by the subject expert. Then if any doubt clearance, you can uh, like clear your doubts. We are having the lots of WhatsApp groups. Okay, just drop your doubt in there, so the aspirants also help you. If they want, we will help you. Okay, so like doubt clearance sessions also will be there for you people. Then validity of the course will be for the 7 month, and the live test will be daily, it will comes to you people. Okay, so till the Norcet 9 exams, right? So this is a very important announcement from our side. Hope this will help you and boost you your preparations, right? So here is the next very important question and very basic question. It will repeatedly strikes in the all the state government, central government exams. That is the Maslow's hierarchy need. Okay, okay. So according to the Maslow's hierarchy, which type of the need must be satisfied first? Okay, which type of the need must be satisfied first before an individual can focus on the higher level of the need? Okay, so this is the Maslow's hierarchy need, where it will start from here. Okay, any common individual, he will start from a very basic and he will go up like this. Okay, so means before going for the next step, he should and must satisfied with this all things. So that is the first and very basic step we are having is the physiological needs. Once after completion of the physiological need only, then the person will think about the next step. This is the a true story of the life, right? So in the physiological needs, what we'll get? We'll get the food, water, sleep, warmth, sex. Okay, so these all are the physiological needs. Okay, so if the person is not having a daily food to eat, if the person is not having the good waters, if the person is not having the good sleep, if the person is not having the good air, means a physiological deficiency is there, means the person will struggle and work for to satisfy the physiological needs only. he will not think about his safety needs. He will not think about to buy the home. Okay, he will not think about his money. He will not think about his family. Okay, why? Because when the person will be satisfied with the physiological need only, then he will have the ability, or he will having the maturity to think on next extent. Okay, so if there is no physiological need only, the person will not move to the next step. Okay, so before going to the higher level of the steps, the very basic need is the physiological need. Okay, and so these Maslow's hierarchy need are many times used to describe the priority based on nursing questions. Okay, so the priority questions will be solved by the one is the by applying the airway, breathing, circulation as a priority, and a second one is by the Maslow's hierarchy need, where we will give the first priority to the basic physiological needs. Okay, so most important, once the basic physiological need is completed, means the person is satisfied with the food, water, okay, sleep, warm, sex, everything. The physiological need is completed, means next he will think about, okay, so safety needs means he will think about, he wants to buy one small home. Okay, so he want to buy some like car and all. Okay, that is the safety need he will think about. Okay, personal financial security and well-being needs he will think. Okay, once he is satisfied with the safety needs, then he will go for the social needs, that is the love and belongings. Okay, so here he will start to make the friendship, intimacy, family, love and belongings, he will starts in the uh, third step. Okay, once he is satisfied with the all the love and belongings and the social needs, then he will start to think about the esteem needs. Okay, so here he will start things about the requirement of the freedom. Okay, requirement of the recognition, self confidence, attention seekings. Okay, so competences. Okay, he will think about the self esteem needs. Okay, once the self esteem needs is completed, then he will go for the self actualization need. The highest need in the Maslow's hierarchy need is the, that is the self actualization need. So it is many time asked questions in the exams. Okay, so achieving the full potential of the seeking the happiness. So okay, here the patient is completely satisfied with the physiological need, safety need is having, social need is having, esteem need is having. Now he just wants to be a fully potentially work. Okay, just he wants to seek a happiness. So at that particular extent of the high level of the need, we call as in the self actualization need. So this is many time asked in the question. The highest level of the need is the self actualization need. So the basic level of the need is the physiological need. So most importantly, bacho, so don't neglect these theory based questions, because it will repeatedly striking and repeatedly coming in your exams, right? So hope this one is clear to you people. And here's the question. Okay, so that is simply asking, according to Maslow, which type of the need must be satisfied first before individual can focus on the higher level of the need. Okay, so before focusing on the higher level of the need, the physiological need should be satisfied completely. Okay, hope it is completely clear to you people. Okay, then comes to the next and very important question. So after this question, I will clear all the important points, nearly 20 to 25 golden points you people will get with a clear explanation and rationally. Okay, so yes, do watch and take a notes, because it's very important, right? So the question is very simple. Whoever wants to answer, so please do comment in the comment box. Okay, a nurse decides not to tell the truth to a patient about the terminal diagnosis. Okay, so patient is diagnosed with some terminal illness, and nurse is now deciding not to tell the truth to the patient about his terminal diagnosis, and this violates which ethical principle, bacho? So the option is the justice. Justice is the ethical principle where we have to treat every individual without differentiating them on their sex, on their uh, color, on their like level in the society. Okay, so without differentiating them, okay, without differentiating by the caste, without differentiating by the color, without differentiating by the any kind of the discrepancies. Okay, we will have to treat every individual as on the equal. So that is what we call as in the justice as a ethical principle for the nurses. Okay, then comes to the autonomy. Autonomy is the, we have to respect the self decision of the patient regarding his care. Okay, so that is what we call as in the autonomy. Then comes to the fidelity. Fidelity is means, okay, being faithful to the patient. Okay, so that is what we call as the fidelity. Okay, what it means, So you have given some promises to the patient means you have to complete that promises. Okay. So that is what we call as the keeping the promises or being faithful to the patient. So that is what we call as the fidelity. Then comes to the veracity. Veracity means yes, ವೀರರು ಯಾವಾಗಲೂ ಸತ್ಯವನ್ನೇ ಹೇಳುತ್ತಾರೆ, right? So the people so who are Veera, Shura, okay, so they are always keeps on telling the truth, right? So here the patient, the nurse decides to not to tell the truth means which ethical principle is violated here? Okay, which violates with ethical principle, which violates the veracity, right? So right, because the veracity means we have to always tell the truth to the patient. Okay, we have to always tell the truth to the patient. Here the nurse decided to not to tell the truth. Okay, it is violating the veracity. Okay, hope it is clear to you people, and these are the ethical principle and most important for you people for your upcoming Norcet exam and all the state and central government exams. So please take a screenshot of this one or take a note of this one. Okay, so the ethical principle autonomy means what it stands actually. The ethical principle autonomy means, yes, already explained, we have to respect the patient. Okay, so we have to respect the patient decisions here. Okay, regarding his own care. That is what we call as the autonomy. Then what is the meaning of the beneficence? Okay, beneficence means doing good and acting in the best interest of the patient. Okay, so that is what we call as the beneficence means we have to do good to the patient, right? Okay, so that is the most important. Then comes to the non-maleficence. Okay, don't harm to the patient. Okay, avoid harming or injury to the patient. Okay, avoiding the harming or injury to the patient is the non-maleficence. Most important, repeatedly ask the questions, beneficence and the non-maleficence and the autonomy. Okay, so very important. Then comes to the justice, already explained, treating all patients fairly and equally without any discrepancy by their gender, by their sex, by their color, by their whatever it may be. Okay, so we have to treat all the patient equally. Then comes to the fidelity means being faithful or keeping the promises to the patient. Okay, so that is called as the fidelity. How to remember, sir? F to F. Okay, so fidelity is being faithful, right? So remember it. Then comes to the veracity. What is the meaning of veracity? Yes, ವೀರರು ಸತ್ಯವನ್ನು ಹೇಳುತ್ತಾರೆ. The people who are called as the Veera, Shura, Dhira, so always they will tell the truth. Okay, so here the veracity means telling the truth and being honest to the patient. So that is what we call as the veracity, the most very important question. Okay, so it is a very important question. Then comes to the confidentiality and accountability. Okay, most important question, repeatedly asked in the exam. Okay, so I will give all these questions to your practices in the all test series. Okay, so daily you will get the question on this one for the next 7 days on the each one term. I want every of my aspirants to, or every of my students who are giving the test series, okay, attend it correctly, make it very clear in your mind, because the one term from this all listed term will definitely strikes in your upcoming exam. Okay, so the confidentiality, what it means, so we have to keep all the personal information of the patient confidential means we should not disclose the patient data in front of the others. We will not say the patient details in front of the others. Okay, we have to keep the everything confidential. Okay, keeping the patient information private and secure. So that is what we call as the confidentiality. This word is very important, bacho. Okay, so then comes to the accountability. What is the accountability? Accountability means taking responsibility of the one's own nursing action. Okay, so we have done some nursing actions means we have to take its responsibility on our own. Okay, because we have did that one, so we are responsible for that one. Okay, for example, so you have loaded a medication, chemotherapy drug you have loaded, you consider. Okay, so you have kept that vial on the table only, you have not discarded the vial, means you are not accountable for that one, means it, what it's showing means you are not accountable, right? So if you are accountable means you have to discard that one in a particular designated biomedical waste management. Okay, so whatever the action you are doing, you are only responsible for that one. So that is what we call as in the accountability. Okay, if you are doing everything perfectly by taking it as your own responsibility, so that is the accountability. If you are not taking responsibilities means that is the threat to the accountability. You should not do that one in the clinical settings. Okay, taking the responsibility of the one's one nursing action is called as the accountability. Very important terms. Again, I am repeating from this all listed terms, one definitely word will comes in your exam. Okay, so hope it is clear to everyone. Then comes to the next most important question. Okay, so consider from this question explanation, from this below question explanation, definitely the meaning of the one term will be asked in your upcoming Norcet 9 prelims or the Norcet 9 mains exam. Okay, bachcho, don't neglect this one. Whatever the example I am giving here, whatever the explanation I am giving here, listen carefully. Okay, practice it perfectly because it is very important, right? So then comes to the question here. Okay, the question is very simple. A nurse begins to sharing a personal problem with the patient and accepts the patient invitation to meet outside the hospital after the discharge. What does this behavior represents? Option in front of you all here is the counter transference, the boundary violation, the transference, and the resistance. So please choose the correct answer for this one. Yes, a nurse begins to sharing a personal problem with a patient, okay, and accepting a patient invitation to meet outside the hospital after the discharge. What does this behavior represents? Option A is the counter transference, boundary violation. Option B, transference, then resistance. Okay, what it is the correct answer? Please do choose the correct answer. Yes, yes, this is a clearly a boundary violation. Sir, then what is the transference, sir? What is the counter transference, sir? What is the resistance, sir? Yes, I will explain to you people. Don't have to worry about that. Okay. So that comes to the first very important word, that is the transference. Here in the transference, a patient who shows the exaggerated feelings, emotions towards the healthcare provider by comparing the healthcare provider or the nurse with his one family member or with his known people, right? For example, after 7 days of the admission, a nurse is repeatedly caring to a patient continuously for 7 days. Okay, so there is a therapeutic nurse-patient relationship going well. Suddenly, a patient will tell, "Madam, you are taking care of me like my mother." Means a patient will show the exaggerated emotions and feelings towards the nurse. So that is what we call as in the transference. Okay, what we call that one is in the transference. So this is a therapeutic impasses we will face in the therapeutic nurse patient relationship. Okay, so what are the four options which are available here? These all are the therapeutic impasses we will faces in the nurse patient relationship. Okay, so this is the transference. Hope it is clear. Then comes to the counter transference. Okay, it's opposite of the transference, where the healthcare provider or the nursing officers will show the exaggerated emotion, exaggerated feelings towards the patient. Means, so in the transference, the patient is showing the emotion and feelings on the healthcare provider. Here, the healthcare provider only showing the exaggerated response and feelings to the exaggerated feelings and emotions to the patients. That is what we call as in the counter transference. Okay, so here, for example, the nursing officer or the healthcare provider will tell to the patient, okay, so when I will see you, I will remember my I will remember my elder brother or the younger brother. Okay, so like this, so the emotions will be transferred or the feelings will be transferred from the healthcare provider to the patient. So that is the counter transference. From the patient to the healthcare provider, that is the transference. Sir, then what about the resistance? Bacho, this is the most dangerous therapeutic impasses where we will face in a therapeutic nurse patient relationship. There is the resistance. So what it means, sir? Why we are saying it is on the dangerous? Mainly it will be seen in the psychiatric patient. Consider a patient who is admitted in the ward since from the 15 days, because all of you know that the psychiatric patients will having the chronic admissions, means a long day admissions, right? So a nurse is daily caring to the patient, and there is a good therapeutic nurse patient relationship. When will a therapeutic nurse patient relationship comes to the end, at that point of the time, patient will not get a way to vomit it out his anxiety. So at that particular time, a patient will start to represent all the previous symptoms again, means all the symptoms which are subsided during the entire day of the entire duration of the admission, the patient will try to show all the symptoms again back here. Okay, so that is what we call as in the resistance. Okay, it will show the failure of the treatment, but it is actually not a failure of the treatment, it is in the therapeutic impasses in the nurse patient relationship. Okay, so here the suddenly patient represents the all subsided symptoms, so that's the example of the resistance. With this example only, examiner will throw the question in front of you people in the Norcet prelims, mains, or other JMCH and the KGMA exams or other exams. So these four words are the very important words, and the boundary violation is the fourth therapeutic impulses in this boundary violation. Okay, so the nurse will make a social, personal, and unprofessional relationship with the patient. So that is what we call as the boundary violation. So that is the not acceptable in the profession. Okay. So hope these four words are very clear to you people. And here the nurse begins to share the personal problems with the patient and accepts the patient invitations to meet the outside the hospital. Okay, after the discharge, what does it behavior represents? So that is the boundary violation. In the boundary violation, other terms also it will comes like accepting the gift from the patient, accepting the gift from patient. We should not and we will never ever should accept the gift from the patient. If you are accepting the gift from the patient, it will go as than the boundary violation. Okay, so this is a wrong thing, right? So hope the concept and all the four words are clear with the example. Okay, so yes, if the concept is clear to you people and any one of you are watching the video first time, so please do hit the subscribe button. And as all of you know that with your support, with your consistency on our channel, so today we have reached the 10K subscriber. Okay, so congratulations to entire team, Master Nursing Classes team, and the followers and the students and the aspirants and the supporters of the Master Nursing Classes. We are very thankful to you people. Okay, so very thankful to you, every one of you, right? So please do share the videos with your friends also, right? So yes, so here's the next very important question in front of you people. Okay, which of the following is an example of the intentional tort in nursing? Which of the following is an example of the intentional tort in the nursing? First we have to say what is tort, then I will go for the what is intentional tort, what is the unintentional tort. Okay, so tort is any unlawful activity where it is ending with a damage to the patient. Okay, so that is what we call as the tort. Okay, so here are the two types of the tort. One is intentional tort, another one is the unintentional tort. Okay, so in the intentional tort, many things will come like assault will come, battery will come, defamation will come. Okay, so these are the examples of the intentional tort. Okay, where the healthcare provider or the nurse or the any hospital staff intentionally damaging to the patient. So that is the intentional tort. Okay, so the unintentional tort are where we are don't having any intention to damage to the patient. Okay, it happens by mistakenly, it happens because of the below standard care. Okay, that is what we call as the unintentional tort. Only two types of the unintentional torts are there. One is M, one is N. One is M, another one is N. Remember, so only two unintentional torts are there. Okay, one is the N, another one is M. One is N, another one is M. What is that? N here is the negligence and M here is the malpractice. Okay, so rest all like assault, battery, defamation. Okay, so fraud. So this all thing comes under the intentional tort. In unintentional tort, two things are there: malpractice, negligence. Okay, why I am repeatedly stating these statements? Because there is another one form of the question in front of you. It will comes in front of you people like which of the following is an unintentional tort? Okay, where they will give you an example, there will give you options like assault, battery, okay, malpractice, and the fraud. Okay, so just you have to look at those N and M. Okay, if the N and M is getting, so that's the unintentional tort. Okay, which all are not intentional tort. So I am fixing one question in your mind. Remember, okay. So which of the following is an example of the intentional tort in the nursing? So option A is telling that administering the wrong medication by mistakenly. Bacho, this is the medication error. So this medication error is an unintentional tort. okay, which will comes under the negligence in the nursing. Okay, so unintentional thought, it will medication error will comes in the negligence in the nursing. Okay, so then comes to the option B, failing to raise the bed rails, okay, and causing a fall to the patient. Okay, so this is also, okay, so failure to prevent the patient falls is also a negligence. Okay, this is also an unintentional thought. Okay, so this is also a unintentional thought, right? So then comes to the option D, not turning a patient leading to the pressure ulcer. Okay, so we have to continuously monitor the patient for the pressure ulcers. Okay, so who are bedridden. Okay, we are unable to monitor, we are unable to assess, or we are unable to monitor the patient. So that is also an example of the unintentional thought. Only the thing option C, that is the, we are restraining a patient without legal justification. Okay, so that is a most important word here. It indicates in the false imprisonment. Okay, so it indicates as the false imprisonment. What it means? False imprisonment means we should leave the patient freely with a legal, after legal procedures. Okay, sorry, after hospital, all the procedures. Okay, we have to allow the patient to go out of the hospital. Okay, after the discharge. Okay, so that is what we call as on the discharge. Even the patient is got discharged, we are not allowing the patient to go out of the hospital. Okay, so we are restraining a patient without any legal justification. So that will comes under the false imprisonment. The false imprisonment is on the intentional thought. Let us see all the examples, all the important terminologies. Okay, so what is battery, what is assault, what is the differentiating word. Okay, everything I will fix in your mind. Okay, read it, repeat it, take a notes of it, and where I am telling it is a differentiating feature. Okay, consider it, because it will strikes in the exam, and it will help you people to in the exams to choose the correct answer, right? So let's start the very important theory portion. Okay, so that is, in the unintentional thought, I told the two things only there. One is the M, another one is the N. Okay, N is the negligence, M is the malpractice. Okay, so first we'll see what is the negligence in the nursing. Okay, so negligence in the nursing is a failure to provide a standard care, whereas reasonably a prudent nurse provide the a particular standard care. Okay, for example, so where a nurse is fully competent who is working at the clinical area, she is giving us such an extent of the high level of the care, where the another nurse is failure to do that high level of the care. That is what we call as negligence. Okay, failure to provide a standard care that is reasonably prudent nurse can provide easily. Okay, so here the one nurse is unable to give the standard care means that is what we call the negligence. Okay, so resulting from the harm and injury to the patient, so that is comes as a tort, right? So it may be examples, it may be a medication error. Okay, so it may be a failure to monitor the patient. Okay, so it may be a failure to prevent the patient falls. Okay, so these all are the unintentional thoughts under the negligence. Okay, so most importantly, next word, there is the malpractice. Malpractice is a part of the negligence where a like, for example, malpractice is a type of the negligence in which a nurse or the healthcare provider fails to perform the duties according to the standard of the care. Okay, for example, here the surgical or procedural error. Okay, what it means, sir? In the surgical error, we have to completely go with a sterile thing. Okay, in the surgical procedure, we have to completely be a sterile thing, right? So consider a nurse is, primary healthcare provider is doing a sterile dressing to a patient. That is the antiseptic sterile dressing, or for aseptic sterile dressing. Okay, so where the nursing officer is assisting at the dressing. Okay, then the healthcare provider will ask for the nursing officer, please give the syringe. Okay, so you are not wearing the gloves. Okay, just you open the syringe and you hold the syringe, and you have given the syringe in the healthcare provider hand, but the healthcare provider is on the sterile clothes. Here you are contaminating the syringe and giving to the patient, healthcare provider, where the that particular healthcare provider is unaware of that one, so he will use that one for the patient care, and there is chance of the infection will be there. So how you have to actually deliver the syringe? Okay, so we have to cut the plastic. Okay, we have to hold the plastic part, and by holding the plastic part only, we have to show the syringe to the patient, and syringe to the doctor. He will take a syringe with his sterile gloves hand. Okay, the syringe also sterile, his hand also sterile, so he can do the procedure perfectly. But when we'll hold it in our hand and we'll give, so that is the contaminating the thing. So here we are failing to do a standard care. Okay, that is what you call as a malpractice. Okay, it may be a surgical error or the procedural error or the failure to follow the physician order, then improper use of the medical equipment. So that is, these all comes as the malpractices. Very important with this clear explanation. Okay, hope it is clear to you people, right? So here is the next very important terminologies. Okay, so tart and it's one line, a very important explanation. So here the assault, what it means? Assault is the, yes, so we are threatening to the patient without touching to the patient. That is what you call as in the assault. Okay, if we are threatening to the patient or if we are damaging to the patient with touching. Okay, so touching to the patient without consent is a battery. Okay, so for example, giving the injection without permission. Okay, so it will come under the battery. Okay, this example is very important, right? So then comes to the false imprisonment. Already I have told you people, we are restricting the patient and we are not allowing the patient to go out of the hospital, okay, without any legal justification. So that is the false imprisonment. Then comes to the defamation. What is the meaning of the defamation? So here the D means destroying, famation means fame. What is the fame? Bacho? So the big personality, VIP personality, they are having the good name and fame. Okay, so if we are destroying their fame means, so that is what you call as the defamation, means we are damaging the patient's reputation, okay, through the false statements. So that is what you call as the defamation. Okay, so in the defamation there are two types of the defamation is that, okay, one is the slander, one is the libel. Okay, so if we are making a false statement in the spoken word, okay, just we are telling to the others, okay, this patient is like this, like that. Okay, so we are stating the false statement about the patient and we are reducing the reputation of the patient, means that is what we call as the defamation. Okay, if we are speaking and reducing the fame of the patient, that is the slander. Okay, if the a false statement in the written form or in the letter form, so that is what we call as the libel. Okay, so to remember, a defamation, slander, yes, in the spoken form, yes. Okay, so defamation, libel in the letter form. Very important with the mnemonic and the tricks I have told. So practice it 2 times. Okay, it will be helpful to you people. Okay, who all are watching these classes from our WhatsApp group, okay, take a screenshot of this one and share in the group, WhatsApp group. Okay, any one of you share, and remaining who all are watching the class, just do thumbs ups to this particular screen. I will see how many of you are continuously engaging in the classes, right? So, right. I will go for the next question. Hope it is clear to everyone. Okay. So here the defamation is clear. Okay. Just we are reducing the fame or reducing the reputation or damaging the reputation of the patient, okay, by false statement. Okay, and it's a 2 types of law, also very much clear to you people, right? So then comes to the invasion of the privacy. Here we are entering to the privacy of the patient. Okay, we are damaging the privacy of the patient, we are destroying the privacy of the patient, okay, without the consent of the patient. That is called as the invasion of the privacy, means we are entering the personal life of the patient without like without any necessary. That is what you call as the invasion of the privacy. Okay, sharing the patient's personal or the medical information without consent, means we are sharing his personal information, means we are entering his personal life. Okay, so we are sharing his information without the consent, means that is the invasion of the privacy. Very important thing. Okay, then the fraud. Okay, here the fraud is the a mispresentation of the facts. Okay, so the fact is different and we whatever the things we will do is the different. Okay, here we are mispresenting the fact for the professional and the personal gain. Okay, that is what you call as the fraud. Okay, so hope, for example, charting of false data, okay, in your vitals chart, in your intake output chart. Okay, so whatever it may be, you are charting the false data, that is comes under the fraud. Okay, very important. Hope the thing is completely clear to you people in this today's class, right? So here is the most important question. Okay, which committee recommended the three-tier system in the three-tier system of the healthcare in India? The most important and high yield question. Okay, so high yield question. Which committee recommended the three-tier important system? Okay, so here the three-tier is the one is at the PHC level, one is the secondary level, and one is the tertiary level. Okay, so three-tier system is recommended by the which committee? Option A Mudaliar committee, option B Boer committee, option C Kartar Singh committee, option D Jangalwala committee. Yes, the answer goes to the Boer committee as a correct answer, and many of you have chosen the correct option. So that is the Boer committee. Okay, in the Boer committee, which started in the year of the 1946. Okay, chairman of the Boer committee is the Sir Joseph Boer. Okay, yes, but any doubts? So please do mention in the comment box, right? So the name of another name of this committee is the Health Survey and Development Committee. Bacho, so entire thing I have written here small and the development I have written here big. Why? Because there is another committee we call as the Health Survey and Planning Committee. Okay, so that is not Boer committee. Health Survey and Planning Committee is the different committee. That is the Mudaliar committee is the Health Survey and Planning Committee. Okay, so the Health Survey and Development Committee is the Boer committee. Okay, how to remember, sir? That is the Madhya Pradesh, and yes, this is the BD. Okay, that's the two times in the day. BD, Boer Committee, Development Committee. Okay, so Madhya Pradesh, that is the MP. That is the Mudaliar Committee is the Planning Committee. Okay, Health Survey and Development Committee is the Boer Committee. The many time asked question. Health Survey and Planning Committee is the Mudaliar Committee. The many time asked question. Okay, so the aim of this committee is to develop the comprehensive health system. Means we have to integrate the all very rural area health system to the very updated area health system. Okay, that is we are trying to comprehensively integrate the health system. So that is the main aim of the Boer committee. Okay, so here the three-tier system will be there. One is at the PHC level, one is at the secondary unit, one is at the tertiary unit. Okay, so the primary it recommends the PHC unit. So 20,000 to 30,000 populations, so there should be every one PHC. The Boer committee recommended, and secondary unit should be cover 1.5 lakh to 2 lakh population, and a tertiary unit should cover the specialized services. Okay, so this is the recommendation by the Boer committee. So initially they have considered, then the updated things, everything came. Okay, so now we are having the Ayushman Arogya Mandir, that is the sub-center, then a PHC, then a CHC, then the Taluka hospital, then the district hospitals. Okay, so like this we are having now the systems in the healthcare delivery systems, right? So then its main focus is to integrate the preventive and curative services. Okay, so integration, yes, this is happened. Okay, this was the strong point considered by the Mudaliar committee. So then focus on the rural healthcare also. Boer committee. So this is also a Boer committee. Then universal free healthcare for all also recommended by the Boer committee. Okay, hope it is clear, right? So just what I told in the previous question. So the question is came here like this: the health survey and planning committee is popularly known as which committee? Bacho, please do fatafat comment in the comment box. Just now in the last question I have explained this thing. Yes, I'm waiting for your answer in the comment box. So please do fatafat answer. Well done, better. Right? So here just now only I have told that is the planning is the MP Madhya Pradesh. That is the Mudaliar committee is the health survey and planning committee है रटने का चीज है रट दो okay so wherever the concept is there I will teach the concept okay कहाँ पे रटना है I will teach the how to remember this one okay both multidimensional right so the health survey and planning committee is the popularly known as the Mudaliar committee and Boer committee is the health survey and development committee is the our Boer committee, right? The Mudaliar committee is the health survey and planning committee. Then Srivatsav committee is the committee of the reorientation of the medical education. So, which committee recommended the Rome? The exam will question will throw in the exam. Okay, so examiner will ask the question. Which committee recommended the Rome? That is the reorientation of the medical education, where the Mudaliar recommends, Srivatsav sir recommends the 3 months training to the all the MBBS students and nursing students or healthcare professional at the village level. Okay, so when you are in the second year, third year of your BSc nursing, you have visited the villages. Okay, as a community posting. So those are the recommendation. comes from the Srivatsal sir committee. Okay, so then comes to the Jangalwala committee. Okay, very important and very standard committee I used to say, because this Jangalwala committee is clearly said, okay, no any private practices for the government doctors. Okay, so there should be no any private clinic should be run by the government doctors. Okay, which will be recommended by the Jangalwala committee. Okay, so we'll solve the questions in the next questions. Okay, don't have to worry about that one. Okay, so the next question is the main focus of the Chadda committee. Okay, what is the main focus of the Chadda committee? Chadda committee is the most importantly worked on the malaria program, the National Malaria Eradication Program. Okay, National Malaria Eradication Program. In this one, okay, so the Chadda committee given the clear roles and responsibility of the PHC, okay, to control the malaria. Okay, so that is a malaria surveillance should be done. Okay, like larva survey and mosquito breed survey. Okay, everything will be done at the rural level. Okay, that is the recommendation by the our Chadda committee. Malaria surveillance through the by general health services. Okay, general health services is the PHC is the general health service from here. So they have to conduct the malaria surveillances very importantly, and they have to report the cases to the higher healthcare facilities if any noticed malaria cases, right? So this is the recommendation by the Chadda committee. Okay, so remember, this is the Chadda. What you can say? So half pant you can say, or you can say the Chadda. Okay, this is your full leg, and this is the Chadda. Okay, if you are wearing this only half pant, the mosquito will bite to your leg, and there is chance of the malaria will be there. Okay, remember. So the Chadda committee worked on the malaria. Okay, this is just for the remember purpose. Okay, so don't consider this one as a serious, because so the sir like whatever the team worked in the Chadda committee was the very great team of the healthcare system. Okay, they have recommended all the guidelines on the malaria control, and they are the a backbone where we are living today with a malaria free environment. Okay, so just for the remembering purpose I have told like that. Okay, so the malaria surveillance through the general health services, it is the most important recommendation by the Chadda committee, right? So most important question. Then comes to the another very important question for you all, right? That is the very simple question again. A 28-year-old woman avoids elevators and the closed rooms due to the intense fear and anxiety. So here she is not a kid. She is a 28-year-old woman. She is avoiding elevators or the lifts, we can say, or the closed rooms, we can say, due to the intense fear and anxiety. She reports palpitation, breathlessness when confined. Means when she will be confined in the closed spaces, okay, that may be a lift, that may be a closed rooms. So she will having the palpitation, means that indicating the anxiety. Okay, so there is nothing to fear. Okay, so without any stimulus, she is getting fear, means it's an the irrational fear. So we call that one as in the phobia. Okay, what is phobia? Phobia is in the irrational fear. Okay, consider you are a single girl who is walking at the road, and there is a big dog which is coming behind you. Means there is a stimuli is there, and you are getting the anxiety and fear. So that is the rational fear. Okay, so you are just in a garden where the thousand of the people are around surround you, everyone is enjoying themselves. Still, you are getting the fear. Means there is no any rational. So that is what we call as the irrational fear. So irrational fear in the psychiatry we call as in the phobia. Okay. So here the 28-year-old woman, she is getting a fear of the closed spaces. So what we call that one? So we call that one as in the claustrophobia. Okay. So what is the answer? And almost all of you have chosen the correct answer. That is the claustrophobia. Okay. So then what is the agoraphobia, sir? Agoraphobia is the fear of the open spaces or fear of being away from the home. Okay. So if the woman or the person, if the patient is staying in the home, means he is very comfort. He is not having any anxiety. When he will lands out of the home and when he will be in the open spaces, the patient will start get fear. So the irrational fear at the open spaces or in the situations which are away from the home, that is what we call as the agoraphobia. Okay, then comes to the social phobia. So what is social phobia? There is irrational fear to present themselves or to work in the presence of the others. Okay, so social fear is the irrational fear to communicate or irrational fear to do activities in the presence of the society or in the presence of the any other external individual is standing in front of you people, and you are getting the irrational fear to perform the activities and to communicate. So that is what we call as the social phobia. What is social phobia? Social phobia is the irrational fears, okay, to do to perform the activities or to communicate in the presence of the other. That is what we call as in the social phobia. Okay, then what we call as the acrophobia. Okay, so acro means height. Okay, acromegaly. Okay, right. So the big height, like acro means the height. Okay, so the height is fear of the height is there means, so that is what we call as in the acrophobia. Okay, the question asked with the closed spaces fear. So the closed spaces fear, that is what we call as the claustrophobia goes to the correct answer for this particular question. Okay, hope it is clear to you people, right? So this was the most important thing, and these are the terminologies repeatedly strikes in your exams. Okay, so please do read the all the terminology once with me. Okay, revise twice and finish it, because the questions will strikes in the exam. Okay, so what is the arachnophobia? Arachnophobia is the fear of the spiders. The most girls will present to the clinic with this particular. Okay, the moms or the parents of the that particular child, they it's not child, so parents of that particular patient will comes to the hospital, and they will inform, they will tell to the psychiatrist that, so she will runs out of the home suddenly when she will see the spider. Okay, so that is what we call as the arachnophobia, is the like a common type of the phobia. Okay, then comes to the acrophobia, is the fear of the height. We have discussed that one, it's an important. Okay, it's an important. Then comes to the claustrophobia, fear of the closed spaces, we have just discussed. Then the aerophobia, fear of the flying. Okay, that is very important. Then comes to the trypanophobia and hematophobia, the most important for your upcoming exam. What is the trypanophobia? Trypanophobia is the fear of the injections. Okay, so most important, bacho, note it down. The trypanophobia is the fear of the injections, and hematophobia is the fear of the blood. Okay, so mostly we will see in the hospitals. Okay, so when come with the injections to administer the medication, so the patient will run out of the bed. Okay, that is the trypanophobia. Then hematophobia. Okay, like we are taking the sample of the patient, so patient will suddenly get palpitates, suddenly it will get me go collapses sometimes. Okay, so that is due to the irrational fear to the bed blood. Okay, so that is the hematophobia most importantly. Then comes to the nyctophobia, means the night time or the dark places fear. Okay, that is the nyctophobia. Then comes to the astrophobia, is the fear of the thunder or the fear of the lightning. Okay, that is the astrophobia, the most important. And another type of the phobia is the thanatophobia, is the fear of the death. Then the emetophobia is the fear of the vomiting. Then the then the entomophobia is the fear of the insects. Okay, so this is the entomophobia, that is the fear of the insects, right? So then hydrophobia is the fear of the water. And these two questions are the assignment to you people. What is the xanthophobia? What is the capnophobia? Okay, so you have to mention in the comment box at the end of this class, right? So what are the assignment I have given? What is the anhedonia? What is the xanthophobia? What is the capnophobia? And one more assignment I have given to you people, so please do comment in the comment box, right? Right, here is the next most important question in front of you people. So the Mukherjee committee recommended a separate staff for what? Mukherjee committee recommended the separate staff for what? Option A is the nutrition services, option B school health services, option C family planning services, option D urban sanitation. बच्चों, previously in a committee where the family planning activities, where the male health worker is doing at the rural area, a Chedda committee recommended to do by the this both family planning committee plus a malaria surveillance committee. Okay, by a one person, that is the male health worker. But after the recommendation of the Mukherjee committee, the Mukherjee committee said we should not use the male health worker both for the malaria surveillance also for the family planning surveillance also. So we will use those particular individuals who are the in the family planning activities. We want the separate staff for this one. They have recommended. Okay, so that is the which committee recommended the separate staff for the family planning activities. There is the Mukherjee committee, or there may be a question like Mukherjee committee recommended separate for staff for the family planning activities. Okay, the question will strikes in the exam, most important. Okay, so then comes to the next very important question. Already discussed the question on the Jangalwala committee. Okay, so according to the Jangalwala committee, okay, what should be eliminated to strengthen the health administration? Okay, so we are having the health administration at the village level, at the taluk level, at the what you can say district level. Okay, what is the action we need to take to strengthen the health administration? Okay, so that is by recommended by the Jangalwala committee, means we should avoid the private practices for the government doctors. And so Jangalwala committee again recommended the very important thing, that is the equal pay for equal work. Okay, so the equal pay for equal work is recommended by the Jangalwala committee, and private practices for the government doctors should be avoided, which is recommended by the Jangalwala committee. The most very important 2 points you have to remember about the Jangalwala committees. These 2 points. Okay, so the next very important question is like here: the Kartar Singh committee is most known for recommending the establishment of the which of the following? Okay, so option A, district health centers. No, it is not recommendation of the Kartar Singh committee. Okay, urban health clinic also not recommended by the Kartar Singh committee. Medical colleges up to the every state also not recommendation of the Kartar Singh committee. The multi-purpose health workers are the recommendation of the our Kartar Singh committee. The most important thing. Okay, so it's an important question. Okay, so the multi-purpose health worker will be recommended by the Kartar Singh committee, the most important committee. Okay, so then comes to the question related to the kits. Okay, so which of the following kit is provided under the CSSM? Okay, so that is the what is the full form of the CSSM? Child survival and safe motherhood. Okay, so conducting a normal deliveries at the PHC level. Okay, so under the CSSM, so which kit should be provided at the PHC level? Okay, so kit A, kit B is provided at the sub-center level, or we can say in the Ayushman Arogya Mandir. Okay, so that is the kit A and kit B will be provided here. Then kit E to P is provided at the CHC level. Okay, so then kit D is the provided at the PHC level. Okay, so it including the delivery kit. Okay, very important. This question will be strike in your exam. Okay, so which kit is provided by under the CSSM for conducting the normal deliveries at the PHC level is the kit D is the correct answer for this one. Okay, so hope this question is very much clear to you people. And here is the next most important question. Okay, so the question is very simple and require the fully involved answer for this particular question to me, right? So please answer. A 10-year-old boy is reported by his parents to speak randomly words and sentences during the sleep. Means a 10-year-old boy is speaking during the sleep without remembering in the next day morning. Okay, he is otherwise healthy. And what is the most likely diagnosis? What happening here? The parents of the 10-year-old boy, they are telling this bacha, when he will sleep, he will speak or random words and random sentences during the sleep. Okay, so when we'll ask him in the next day morning, he will not aware about that one. Okay, so without remembering in the next day morning. Okay, so he is otherwise completely healthy. So what is this condition? Option A is the somnambulism. Somnambulism is the somnam is a sleep. Ambulism means walking. Okay, if the patient is walking, okay, so during the sleep, that is the sleepwalking, means that is the somnambulism. But here's the talking in the sleep, not walking in the sleep. So our answer is not A. Then comes to the option D, anuresis. That is the of passing the urine in the bed. Okay, at the night time, that is the anuresis. completely will discuss about this particular analysis because it's an important. Okay, so then comes to the narcolepsy. Okay, so that is the excessive heavy daytime sleeping. Okay, even after complete sleep at the night, the patient will excessively sleep in the morning also. Okay, so that is the hypersomnia. Means like a patient will sleep like due to the disturbance in the sleep, the patient will excessively sleep in the morning. That is the hypersomnia. But narcolepsy, even the patient will have the good and perfect sleep at the night, still again in the morning the patient will get the excessive sleep. That is what we call as the narcolepsy. Okay, so this is also not our answer. Okay, so the talking or the speaking during the sleep is called as the somnoliquy. Okay, so what we call this one is the somnoliquy. Somnoliquy is the sentence or the word, okay, which is meaning as the sleep talking or the sleep speaking, we can say. Okay, sleep walking is the somnambulism, sleep talking is the somnoliquy. So these words may comes in your exams, that is maybe in our KGMU exam, that may be in your upcoming what we can say Norcet 9 or 8, 9 exams. Okay, so then the JMCH and all state and central government exams. These are the important questions and terminologies very important to you people. Okay, so and there is free quizzes which are going for the KGMU, GMCH and Norcet 9 exams in our WhatsApp group, in our Telegram group. Okay, so daily 2 time quizzes will run free of cost. Okay, so where the quality questions will be discussed by the AIMS nursing officers. So if you want to be a part of that one, so please join to our Telegram group and WhatsApp group. I will give the link of that one in the description box. And as all of you know that we are having the very important plan to you people to practice a very highly updated clinical based scenario based practical based updated questions. Okay, so here a Narset 9 Navagraha plan is there for you people. Okay, so the test series which is including the daily live exams, okay, and all India rank announcement, weekly extra booster class plus extra practice papers. Okay, so then chat box support 24 into 7 with the validity of the 7 month. Okay, the live paper will comes till the Norcet 9 mains exams, right? So this is the beautiful plan to you people here. Okay, if anyone of you wants to join to this particular pack, I have given the link in the description box and in the comment box. So please visit the comment box, drop your 2 comments and download the app, right? So enroll the course today because it's on the very effective course which will give you a perfect rank in the upcoming Narset 9 exam, right? So thank you for watching the video till the end. I hope that today's explanation content is looks quality to you people. Okay, so if you found this is helpful, so please do comment in the comment box. Okay, hit the subscribe button and hit the one like. Your one like matters to us, right? So we'll meet in the tomorrow's class again. Tab tak ke liye, Jai Hind, Jai Bharat. Take care. Love you all. Bye bye.